Hi, Dr. Michael DiMattina, Medical Director at Dominion Fertility. Do you have unexplained infertility? You've been told that, but do you really have unexplained fertility? What is unexplained infertility? First of all, unexplained infertility makes up about 5 to 12% of the causes of infertility. And what it means is that all the medical tests on both you and your partner are normal. So in other words, the tubes are open, the ovulation is regular, the menses are regular, the hormones are normal, and the sperm andrology tests were also normal. So all the diagnostic tests were normal. Where's the baby? That's unexplained infertility. And I'm going to tell you, very few people have that. And I see a lot of patients for the past 33 years. And what I find is patients really need to take an interest in their own health care and start with the word why. Because I see medical records from patients who come from large infertility centers, and the patients are told, yeah, everything's normal. And then I look at the andrology profile, the sperm test, and I find out the count was low. I find out the morphology, the shape of the sperm morphology was abnormal. That's explainable infertility. And in fact, you may not know, 40 to 50% of infertility is male factor related. It has nothing to do with the female. And we see other things like the ovarian reserve testing. Oh yeah, you're fine. And then I look at the AMH and it's less than 1.3. Patient had no idea. So let's start, instead of, do you have unexplained infertility? Let's ask the question, start with the word why. Are your tests really normal? I think you need to take charge and understand that. If you have unexplained infertility, you're one of those few who do, there are treatments for it. The majority of the time, artificial insemination, intrauterine insemination, with or without drugs, fertility drugs, does not work. And in fact, in the old days, before we had IVF, you truly had unexplained infertility. It was the kiss of death. Very few of those patients ever got pregnant and had a baby. With IVF, it changed everything. Because the theory of unexplained infertility is that the sperm can't penetrate the egg. With IVF, we fix that. The theory with unexplained infertility is the egg can't get into the fallopian tube because the tube's dysfunctional. In IVF, the egg's in the dish, we fertilize it, we make the embryo, we put it in. So if you really want to get treated for unexplained infertility, the definitive treatment, the one that works, is IVF. And by the way, patients with unexplained infertility have the highest chances of getting pregnant, some of the highest, because that's all we have to do is make an embryo and put it in and get a baby. Dr. Michael DiMattina, Medical Director at Dominion Fertility, thank you.
Dominion Fertility, making miracles happen, one family at a time.